My name is Professor Rael Strauss. I'm the Director of the Psychiatric Wing of the Ma'aneh HaYehoshua Medical Center.
My name is Dr. Rosalind Landau and I am the co-chairperson of the British Friends of Ma'aneh HaYehoshua Medical Center. We recognise that a person with mental illness is very vulnerable, and our aim is to reduce that vulnerability as much as possible, to ensure that all their needs are acknowledged and taken care of.
Our son, who is mentally ill, has a dear rabbi friend who knew of Ma'aneh HaYehoshua.
And he said, this is something you really need to check out. And it seemed like, wow, this is what we've been looking for.
We cover the range of psychiatric services, beginning from the emergency room to outpatient to day program and to inpatient units.
We have specialised areas. We have a male floor, a female floor, and a children's floor. So once they know they're going to have to come into the hospital, they know that their needs, their own particular needs, are going to be taken care of.
Patients arrive at the emergency room, they are seen almost immediately and received all the services.
And individualised care from the word go.
We have something very unique, which I have never seen anywhere in the world. Patients are seen in the emergency room, in a separate section of the emergency room. Each therapist or each treatment provider has their own separate waiting room outside the individual treatment room. We have a separate wing for families to sit alone with the patients in the privacy of a separate section of the ward. So we do this to preserve the dignity of the patient and their confidentiality. Just because patients have mental illness doesn't mean that they should be treated in conditions that are substandard.
We know that something like this even existed, where the whole person would be looked at as a whole person with dignity and with a lot of love and attention.
We have dedicated staff who are handpicked.
So we make sure that patients get the level of care that I think is deserving of them. We see as one of our focuses as having an open door policy.
Our doors are always open.
Patients can come and go as they want.
We never restrain our patients here.
And it was all open. It wasn't behind a closed door. We could go in as parents who wanted to visit my son and sit there with him. A nice open environment that was airy and beautiful both for us and for the patient.
We make sure that each patient has plenty of room and space.
We have a large staff to patient ratio, a very high staff to patient ratio. There is no overcrowding in our ward. We have a maximum of 24 beds on the ward.
It was clean. There was beautiful murals all over the walls. The bedspreads looked nice and fresh and clean. The plants, the ping pong table, it smelled nice. It didn't smell like a hospital. This was a place that really cared.
We have a dedicated family therapy unit.
A living room, a kitchen, a dining room. We have that all set up as if this is an actual apartment. And we manage the family therapy within the unit, and our results have been phenomenal.
We had not experienced that at any other hospital.
As part of the patient's rehabilitation, we offer a variety of therapies.
Art therapy, drama therapy, music therapy.
Our son is very creative, and Ma'aneh HaYehoshua only worked to try to enhance that.
Patients can connect with aspects of the creative ability that they themselves weren't even aware of. Exercise therapy decreases anxiety, improves mood, and encourages even social interaction. Animal therapy is fascinating. You take a patient who's been sitting in the corner, not connecting with anyone, and you put a rabbit in their hand, they come alive. Suddenly they start connecting with this animal, and it's very touching. It's very touching. And we see phenomenal results in ways that we could never have predicted.
It was like night and day from anything that I had seen, both in Israel and in the United States. It was a healthy environment for healing.
We want our patients to return back to themselves. Our patients receive the best physical and mental health care that we can provide. Our patients have a voice.